I'm Daniel Levine, and this is the Bio Report. In April, the IMS Institute released a new report that U.S. drug spending in 2014 rose 13.1% to $373.9 billion, the largest single-year increase in spending since 2001. A number of factors drove the increase, including the launch of innovative new therapies such as Gilead's hepatitis C drug Sovaldi. We spoke to Murray Aitken, Executive Director of IMS Institute for Health Informatics, about the new report, the confluence of factors that drove spending higher, and what the outlook is for 2015 and beyond. Murray, thanks for joining us.
You're welcome.
We had the biggest increase in U.S. drug spending than in any year since 2001, according to your new report. This is the result of a confluence of factors I thought we could walk through. I think Sovaldi, Gilead's breakthrough hepatitis C drug, has taken the headlines, but it's a bit broader than that in terms of the role innovative drugs have played in pushing spending higher. Sort this out for us. What role did Sovaldi play versus new innovative therapies as a whole?
So, indeed, I think it is important that we take the various components that contributed to this record increase in spending growth into the various pieces. So, with respect to Sovaldi, it was certainly a big part of it. The viral hepatitis treatments, including Sovaldi, but also others, contributed about $11 billion to spending growth in 2014. There were other new drugs in oncology, multiple sclerosis in particular, that also added to the growth in spending on new brands, and which brought that total to a $20 billion contribution to the $43 billion overall growth in spending in 2014. So it's a significant part of the story, and a demonstration that when great new therapies come to market, there is indeed a market for them, and that helped drive the spending growth significantly higher in 2014.
Well, how good a year was 2014 for bringing innovative new therapies to market?
Well, in terms of the number of launches, we saw the most ever since 2001. So we had 42 new launches in 2014. That's a slightly different metric than FDA approvals, as you can appreciate. And we do think that this reflects a number of the measures that have occurred with the FDA over the past several years, starting with the Orphan Drugs Act, and the impact that that's had. We had 18 orphan drugs, a record, launched in 2014. We had 10 drugs launched that carried breakthrough therapy designations from the FDA. We had 5 antibacterials launched, including 4 that came through on the special program there. So the sorts of mechanisms that have been put in place to encourage innovation in certain areas and to provide incremental incentives do seem to be having an impact, at least when measured in terms of the number of these new drugs that are making it through the regulatory process and into the marketplace.
I think one interesting thing to note in the report is that it showed there were a wide range of new launches for larger disease populations offering improved efficacy or administration. I think we're at this point where a lot of attention has been paid to high-priced orphan drugs, but what have we seen in terms of drugs for large population groups and their impact on spending?
Well, We did see 9 drugs. We saw 9 therapy areas with more than 5 million patients potentially able to benefit from drugs newly launched in 2014, and that includes type 2 diabetes, psoriatic arthritis, chronic obstructive pulmonary disease, and so on. So for those products coming into these markets, again with a strong clinical profile, their contribution to growth has been is significant. For those that are coming to market with less differentiated profiles, it's a tougher game for sure. The level of scrutiny placed on new drugs is high. And so the bar has gone up in terms of the clinical differentiation that's required in order to successfully launch a new product in what are very often rather crowded primary care-oriented markets.
Well, as 2014 came to a close, it was clear that Sovaldi was fielding some heat from price competition of other new hepatitis C therapies. It's still early in all of this, but is there any sense of the impact competition is having and the efforts by folks like Express Scripts and others to pit one drug against another to negotiate more favorable pricing?
Well, I think the focus has been a little too much placed on the pricing dynamic and perhaps not enough on the volume dynamic. So what really drove the growth in Hep C spending in 2014 was that 161,000 patients with hepatitis C initiated treatment with one of the new drug options that are now available, and that was up from 17,000 in 2013, a year where clearly patients were being warehoused, but that was still significantly higher than the 35,000 patients who initiated treatment back in 2011 and 12 when other new treatments had come to market. So I think the part of the equation here is the extent to which the volume of patients being treated, and we understand there's about 3 million Americans with hepatitis C, diagnosed or undiagnosed. How do those patients gain access to this medicine, and what percentage of them are being treated? So I think with price competition, if prices indeed are coming down, then we may well see an increase in the volume of patients who are being treated. So I think that sometimes gets lost in the sort of focus on the headline numbers in terms of the price per pill or the amount of discounting that may be going on in this therapy class.
Specialty drugs, you note, now account for a third of the spending. Payers continue to be concerned about disproportionate spending on these. Are you seeing any change in this trend? Is this going to continue to drive overall spending? And if so, what's the consequence?
Well, we do see a very robust pipeline of drugs, particularly in oncology, but in other areas that are in the specialty category. And so we do expect to see more of these drugs coming to market. And again, those with great clinical profiles will be inevitably in demand. So we do expect to see the share of spending on specialty drugs increase. But let's not forget that part of the reason that share is increasing is because we have seen a lot of patent expiries occur in the non-specialty part of the market. So, we are in an era where there have been substantial savings from the patent expiries on traditional drugs, which is helping to fund the unmet needs that these new specialty drugs are addressing. And I think we'll see more of that. We've got a lot of patent expiries coming through in 2015, certainly higher than the level we saw in 2014. That helps to balance the budget, so to speak, but it's also one of the reasons why we do see this a growing share of the market taken by specialty drugs. The other dynamic, however, that's that is coming, very closely on the horizon is the introduction of biosimilars, and again, we will be watching closely to see how that affects things in the coming years.
Well, that's a good point. Let me ask you about that. The loss of patent protection was far more muted in 2014 than what it was in recent years. What's been the trend, and do you expect this to continue, or does another wave await us, particularly with the advent of biosimilars?
So I think there's two things to take apart there. One is that indeed a significant contribution to the 13% headline growth number for the total market in 2014 was the fact that it was an unusually light year in terms of patent expiry impact. We saw about $12 billion reduction in spending on branded drugs as a result of patent expiries in 2014. That compares to $20 billion the year before and $29 billion back in 2012. And that's a reflection of the timing of patent expiries as well as the availability of generics when those patents expire. Over the next 5 years, we have on average a lower level of patent expiries than the past 5 years on average. 2015 will be a reasonably significant year with respect to small molecules. Then we'll see some moderation, but patent expiries will continue to bring savings to the total market. On top of that, we have the advent of biosimilars now available or becoming available in the market. We think it's still going to take a little time for them to find their place and their role, and to see what impact that has on pricing and volume with respect to the biologic drugs. But it's certainly a new factor that needs to be watched closely as these biosimilars increasingly become available.
Well, one of the other drivers here was the Affordable Care Act. What role did that play in all of this?
Well, we saw a couple of things for the first time in 2014 as the implementation of the Affordable Care Act continues. We saw a significant increase in the volume of prescriptions filled through Medicaid. Those states that expanded their coverage for Medicaid saw a 25% increase in the number of prescriptions filled through Medicaid. That compares to a 2.8% increase in those states that did not expand Medicaid. We also saw the new health insurance exchanges begin to operate. We saw a gradual ramp up through the first half of the year, really through October, as people enrolled and began to use those health exchanges. The overall impact on the total market is still fairly modest. We estimate that of the $43 billion growth in the U.S. market last year, about $1 billion could be attributed to the expansion of access provided through the Affordable Care Act. But we do expect that will grow, particularly if additional states expand their Medicaid programs and as more patients enroll in the health insurance exchanges.
As payers look for ways to rein in spending, how much of this is impacting patients directly? How much of this is shifting burden to coming out of pocket?
We do see a continuation of the trend, particularly in the commercial insurance market, to patients enrolling in plans that have some level of pharmacy deductible, in addition to co-payments and co-insurance. The evidence is pretty clear that the higher the deductible, the higher the co-payment amount, the lower the adherence rate from patients on existing medications, and the higher the abandonment rate. In other words, patients are simply not picking up the prescriptions that have been written for them. We do think that this is a big deal in terms of the nature of insurance coverage that employees have, and the impact that this will have in longer-term health costs and consequences. So we know very well that patients who are not adherent with respect to diabetes medicines rather quickly become very ill and very expensive to the health system. We do note that in 2014 we saw a decline in the number of retail prescriptions being filled through commercial plans. Part of that is because a lot of the new enrollees and health exchanges came out of commercial plans, about 70%, we estimate. But part of that reduction is also may also be a reflection of a lower adherence rates as patients have more visibility directly to the costs of their medicines.
I suspect this might be outside the realm of your studies, but do we know at all whether the increased cost, particularly on innovative therapies, is being offset by savings they're creating elsewhere in the healthcare continuum?
Well, that's a little hard to see exactly what's going on at a payer level. Certainly, traditionally the savings for the payers have come from patent expiries and the very rapid adoption of lower cost generic alternatives when they enter the market. And again, that's what made 2014 such a remarkable year, because payers didn't have the benefit of that reduction at the same time they were facing somewhat unexpected increases, it seems, in the level of spending on innovative treatments, and in particular hepatitis C.
What's ahead for 2015 and beyond? Do you see trends continuing, or are we approaching some point where there will be a substantial effort to address drug spending and slow its growth?
Well, I think we see a couple of things playing out. First off, we do expect the growth in the market in 2015 to be lower than it was in 2014. Again, that's partly a reflection that these unique circumstances of 2014 we don't expect to repeat. So we will see a larger savings from generic events in 2015. We don't expect to see an incremental growth in new drug spending that we saw in 2014. So growth will certainly moderate this year, and indeed for the next 5 years. We won't see another 13% growth rate. I think the other thing to watch is what's happening on the insurance front, both in terms of the Medicaid expansion, the increased use of the health exchanges, and then what's really happening on the commercial insurance side, and will we continue to see a decline in the use of drugs in that part of the market, or will there be countervailing forces at play, particularly by payers and providers who are carrying more risk going forward than they have in the past, and therefore, in fact, will be turning their attention to the issues of adherence. What we hear already is that some plans are offering drugs with zero copays for certain conditions, so that patients become more adherent because they recognize the benefit that brings them. And as we move our health system from a primarily fee-for-service to more of an outcomes and performance basis, we will see new forces at play with respect to the role that medicines are playing, and therefore the amount being spent on those medicines in the overall healthcare context.
Murray Aitken, Executive Director of IMS Institute for Health Informatics. Murray, thanks as always.
Great. You're welcome. Thank you.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.